As we've said several times before, there's no avoiding this virus. As it becomes endemic, everyone will eventually have antibodies in their system to it through either getting infected, getting vaccinated against it, or both. And this has put a tremendous strain on our testing resources and our staff. At Novant Health system-wide, we now have well over 500 patients in the hospital with COVID or recovering from COVID, and still over 80% of those patients are not vaccinated. And 98% of those patients are not vaccinated or are vaccinated and unboosted. Those that are vaccinated in the hospital are often older patients with multiple health problems who are not boosted. Per the CDC, getting a booster restores vaccine effectiveness against infection to about 75%. So again, another way of saying all that is only 2% of our current patients in the hospital have been vaccinated with a booster, and their average age is 77 years old. So getting vaccinated and getting that booster, if you're eligible, is a real great way to keep yourself out of the hospital. While the number of hospitalizations isn't rising quite as sharply because we aren't seeing the same case to hospitalization ratio we saw with Delta, the sheer volume of cases means that our hospitals, in addition to our testing sites, which Nikki will cover here in a minute, are incredibly busy yet again. We're over 90% capacity in our inpatient facilities system-wide, with some facilities nearing 98 to 99% capacity. We do have the ability to add bed capacity, but with our capacity to add beds comes the need for additional clinical care teams to support them. We do continue to monitor the data closely and stand ready to activate any additional surge planning scenarios, from a staffing contingency plan to the utilization of additional space or campuses should we need to. You know, it's important for our communities to know that we have the continued ability to care for them, and they should seek care if they need it. If you have a medical issue, you need to seek care. However, given our current COVID volumes, our ability to do things like elective non-emergency surgery may become more limited. And to that end, because of these high volumes and our concerns about the number of cases, we're moving to freeze any additional non-time sensitive surgery cases in the greater Winston-Salem market for this week until we have a better idea of the volumes we have to address. I think the issue is that we're still working through all of this, you know, as a community, as a nation, the whole world. You know, what is the different clinical presentations between Omicron and Delta? And there's a sense generally that Omicron may cause less severe disease. That's kind of what's thought right now. And part of that is where it replicates. It tends to replicate more in airways than in lungs. However, it's incredibly contagious. So if you have a variant like Omicron that maybe causes less severe disease, but causes far more cases, just the sheer volume of cases is going to lead to more hospitalization. So we haven't reached the hospitalization number peak we did with Delta, despite we've exceeded the case count with Delta, with Omicron. But you know, a less severe virus that hits way more people, it's going to result in higher numbers of hospitalization. So that's the only saving grace right now. If Omicron put people in the hospital like Delta did, the healthcare system would have collapsed in our country by now. So we're still pushing the boundaries of what hospitals can handle, and I think it's going to be like that